Hypnosis has a long, rich history with all sorts of things, actually, including but not limited to pain management up to surgical anesthesia. Of course, there had to be a first one, right? Hi, I'm Dave Ruby, and this video is not about the first ever hypnosis for surgical anesthesia, but it is about Dr. James Esdaile's first time doing mesmerism to get anesthetic properties from a patient. And just to kind of forestall arguments, mesmerism and hypnosis aren't quite the same thing, but for the sake of discussion, traditional hypnosis and mesmerism both sought to get a trance state out of their patients. And we'll kind of talk about that a bit later in the video, but for now just consider that a mesmeric trance was sort of akin to a deep hypnotic state. So going back to Esdaile, Esdaile was a Scottish physician who practiced in India in the mid-19th century, and his first procedure was with a man named, I'll probably mess this up, but Madhab Kaura. I read it in a book, didn't hear it. And Madhab was actually in jail for almost killing a man when he developed what was called a double hydrocele. And per Mayo Clinic, a hydrocele is a type of swelling in the scrotum that occurs when fluid collects around the testicle, which sounds rather unpleasant. As I first heard it presented, this actually wasn't just like a tumor or just a swelling. This was so big he actually was using it as a desk to write on. So, wry humor aside, this was a very serious and probably very unpleasant thing for this man. And in fact, as Esdaile describes it, it was. Also of note is that this took place in the early or mid 19th century. Unfortunately for Madhab, this predated anesthesia, so this was an unpleasant procedure at best. But as I originally heard it, and this is what makes it so fascinating, I originally heard it that essentially Esdaile did the mesmeric procedure, got a deep trance, and had a successful surgery, which was amazing. This was the early and mid 1800s. But I actually recently dug deeper into Esdaile's account, and it went far less smooth than that would have led me to believe. So let's find out about it. So as described by Esdaile, this took place on April 4th of whatever year it was. And Esdaile describes the man as Madhab is actually having thrown his head over the back of the chair and pressing his hands along where they were injecting, grimacing and closing his eyes and being in a great deal of pain. And to his credit, seeing him in suffering and pain, Esdaile decided to try something different. So he actually turned to the sub-assistant, a student at the medical college, and asked the man if he'd ever seen mesmerism. To which, not very reassuringly I might add, the man said, yeah, he'd seen it in college, but essentially it had no effect, it didn't work. To which, equally unreassuring, Esdaile said, I have a great mind to try it on this man, but as I never saw it practiced, and know only from reading, I shall probably not succeed. So yes, Esdaile had only read about this in a book, never saw it done, never tried it, and he was going to first do it on this patient who was in the middle of the procedure. Not the best bedside manner, but if you're Madhab, what other options have you got, right? So Esdaile does what he read in the book. He does mesmeric passes for about 45 minutes and basically says it failed. In fact, in his own words, he says he gave it up in despair and declared it to be a failure. And a little bit about mesmeric passes, as I've seen it done, there are still people that practice this actually. As I've seen it done, the passes are more like Reiki, where they kind of move their hands along the body as if they're raking energy. So Esdaile did this for 45 minutes, basically had no effect, and he gives up. So as Esdaile is resting, he notices the man's making fewer grimaces and remain fairly quiet. So when the man is asked to open his eyes, he basically says he sees smoke in the room, which if you're a hypnotist, you might recognize as being a visual hallucination. So not surprisingly, this got Esdaile's attention. So he goes back to it, and he does the mesmeric passes for about an hour afterwards, at which point the man showed no effect of the procedure, which is perfect. So they had a pain-free procedure. Apparently, Esdaile wasn't quite satisfied at this, so he decided to test his work. And he did a number of things to kind of test if the trance was in a basically profound enough state. So first he pinches a man, I'm guessing on the arm or something, and fairly benign. Then he sticks a needle in the small of the man's back, or a pin in the small of the man's back. Then he applies fire to the man's knee. I'm assuming he meant like a match or a candle, but it was left very, very ambiguous, all without any effect. Great. But he still isn't done. He then, and I'm reading directly, he had Madhav inhale liquid ammonia for some minutes without causing an eyelid to quiver. So he has this man inhaling ammonia for some period of time, which didn't wake him up, but it did revive him enough where Esdaile could ask if he wants something to drink. And what is not great bedside manner now, but at the time, apparently passed, Esdaile gave him a mixture of ammonia so strong that Esdaile couldn't even bear to taste it. And the man drank it like milk. Again, terrible bedside manner for present times, but it did show that, for whatever you want to say about it, it did show this was having a profound effect. So, last thing Esdaile did, which is more what you might do now, is he opened the man's eyes and shined a light, and the iris did not move at all, didn't dilate or contract. So at this point, Esdaile had done all the testing apparently he thought of to do, and it was pretty satisfied this was a real thing. So back to the procedure, they did the procedure and it worked really well. And they carried Madhav back to the prison, and when they couldn't wake him up, they, again, terrible bedside manner, they threw water in his face, at which point he apparently revived himself. So all of that rather strange treatment aside, after the procedure, they asked Madhav how he felt, asked him to report on it. And Madhav reported basically no pain of any sort or awareness of anything Esdaile did during the procedure. And afterwards, he only had minor pain from the procedure itself. So Esdaile would go on to perform, I believe it was over 345 procedures, including treating hydrocels who were up to and over 100 pounds. So this kind of became a niche for him of sorts. But back to modern hypnosis, if we tie this back into contemporary times, earlier in the 1900s, Dave Elman wrote this book, Hypnotherapy, and he actually, in this book, he describes what was referred to at the time as a hypnotic coma, where in stage shows, hypnotists would, at least on occasion, have subjects that would go into this profound, deep, and apparently enjoyable trance state called the hypnotic coma, and they wouldn't come out. Now, what they found was that people actually, it wasn't that they couldn't come out, they just didn't want to. It felt very enjoyable, and they really didn't feel any pain. They were very happy to stay there, so to speak. And that was seen as a bad thing because you don't want people that's going to trance and not coming out. So what Elman did was he actually found or created a protocol to guide people into this for beneficial purposes. And that can be used for surgical anesthesia or even just a deeper, profound, relaxed state. So it's definitely worth a read. And again, there is some discussion if mesmerism and hypnosis are the same thing, but they do seem to be able to achieve the same state. At least in Dave Elman's book, you can get to that same state with the Esdaile protocol. So if you have any questions or comments or suggestions for other videos, then please leave a comment in this comment section below or send me an email. And if you're interested in reading more, the book from Dr. James Esdaile is public domain, so I'll link that in the comments. Also, if you're interested, I'll leave a link to Jason Linett doing a wonderful demo of the Esdaile State for one of his trainings back at Virginia Hypnosis some time ago. So thanks for your time. Have a great day.